Good day to you, Doc. Thank you very much for joining us. I was wondering if you have any thoughts on why Africa, sub-Saharan Africa in particular, doesn't seem to be as badly affected yet by the pandemic. We are assured it's coming, but our numbers are way lower than countries in Europe and America.
Yeah, so I think part of this is time. So our phase started after sort of America and Europe, probably because of the trade routes. And I think we have to be very careful to not be complacent, because though there are some factors that people are looking into and researchers are looking into in terms of the sun, vitamin D, are we protected because of the diseases that Africa has in terms of HIV, TB and BCG vaccination, I think at this stage, without robust evidence, we have to assume that we will have the same rates as other countries have shown. The other thing that's important to remember is that though we have seen incredible leadership across sub-Saharan Africa from our presidents and prime ministers in terms of lockdown, we have probably postponed rather than actually avoided. And as countries begin to ramp up testing, that is when we will see the numbers rise, most likely. So at this stage, I would say most of us are making decisions based on the fact that we are likely to see similar numbers to other countries in the world.
Which countries are you most concerned about in sub-Saharan Africa? I mean, I'm hearing astonishing figures of like a handful of ICU beds, 1 or 2 ventilators in some countries. Where are you most concerned at this point?
Yes, so of course, healthcare systems across Africa are chronically underfunded and have much weaker ability to respond to a huge rise in cases. So, I wouldn't want to pick on one country or the other. I would say even those countries with the weak health systems, we've seen courageous decision-making by our leaders and incredible collaboration. The ones I would most worry about is where we're not seeing the solidarity of response between everyone that needs to get on board, including citizens, to keep the population safe. And the other ones are the ones that are sort of in denial of what is likely to come. But otherwise, I think we're all in the same boat, and I think the solidarity amongst the countries in sub-Saharan Africa is going to be critical.
It's a very difficult situation because numbers are still relatively low in Africa, and we know already the economic impact is going to be massive. We are heading in sub-Saharan Africa, I think, for our first recession for the entire region in 25 years. So it's a difficult one. You absolutely have to have public buy-in. Is that another major consideration?
Yes, I mean, I would say for a pandemic like this that affects your social, your sort of perspective, your economic perspective and your health, it's attacking the core of our society. And so we all have a role to play. That's us as responsible citizens, it's government, it's academia, it's private sector. I mean, when it comes to private sector, I would say there's 3 real sort of means of contribution. One, for a company like ourselves, MSD, which is a pharmaceutical company, business continuity is absolutely critical. We make essential medicines and vaccines, and we've got to ensure they continue to get to patients. The second area, and I think South Africa has been an exemplar in this, is actually all of us coming together to leverage our incredible resources, expertise and skills to align with government priorities. So the President's Solidarity Fund is an incredible platform for private sector engagement. I'm personally working on the procurement of personal protective equipment for all healthcare workers in South Africa, and the team is a huge team of private sector volunteers. And then the third area I would really, I think we need to focus on, especially as private sector, especially in countries with weaker health systems, is rightly so, most sub-Saharan African countries will divert their resources to COVID, to managing this pandemic. But there are critical health services like routine immunization, like family planning, like chronic disease management of diabetes and cancer that must continue. Otherwise, after COVID, we're going to see another global health emergency.
Yes, exactly. I mean, we have massive issues, HIV/AIDS. We run the largest AIDS treatment program in the world. We also have a huge TB burden. I was speaking to someone from the DRC just recently, and they were saying they are not not only dealing with the tail end, hopefully, of Ebola, but they're also now having to ramp up with COVID-19. Now, there are lessons to be learned from dealing with HIV, AIDS, with Ebola, but I would imagine it's also very difficult because you have to manage those diseases at the same time.
Right, so there's a positive aspect, right? So our countries in Africa, because they've dealt with HIV and TB, there's two things that we can ramp up as part of the response very quickly. One, because of TB, we know how to do contact tracing, and that is absolutely critical for the COVID response. Second, in terms of HIV, we already have huge amounts of community health workers, and you can see in South Africa, we are quickly switching those community health workers to also test within South Africa, which is going to be absolutely critical. So there's some silver linings. But as you say, there are other things that are getting forgotten. I know at MSD, we're committing $3 million to just ensure essential maternal health services continue to be available and are safe, because we learned during the Ebola pandemic that is ongoing in DRC, that maternal mortality goes up by 50%. So we need to make sure that while the governments continue to focus on COVID, the rest of us begin to support these other essential services of the healthcare system.
Absolutely, and thank you so much for your time. I really do appreciate it. That is Dr. Priya Agrawal. She's the MD for South Africa and Sub-Saharan Africa with the global pharmaceuticals company MSD. And MSD is one of a number of companies working in collaboration with the Bill and Melinda Gates Foundation.